Welcome to Aging Together, a podcast dedicated to exploring the challenges and opportunities of caring for our aging loved ones. This podcast is a product of Caregiver Consulting and Healthy Solutions, a private consulting practice dedicated to helping you navigate the aging process with ease. Together, we will dive into a wide range of topics, including health and wellness, financial planning, caregiving, and more. This podcast is for everyone, whether you are an older adult looking to age in place, a caregiver seeking support and guidance, a young or middle-aged adult planning for the future, or simply someone interested in learning more about the aging process. I hope you'll join me on this journey. Let's navigate aging together. Hi everyone, I'm your host Pooja, and you're listening to Aging Together. June is PTSD Awareness Month. In today's episode, I'm taking a dive into PTSD. Post-traumatic stress disorder is a mental health condition that can affect people of all ages, including older adults. As we observe PTSD Awareness Month, it is crucial to shed light on how this condition manifests in the aging population, its impact on aging, and the necessary care and management strategies. In this week's episode, I'm exploring the key aspects of PTSD in older adults, supported by data and research. PTSD is typically triggered by a traumatic event, such as military combat, natural disasters, accidents, or personal violence. While symptoms may vary among individuals, common signs and symptoms of PTSD in older adults include distressing flashbacks or intrusive memories of the traumatic event, avoidance of reminders associated with the trauma, and hyperarousal manifested through sleep disturbances, irritability, and difficulty concentrating. Studies suggest that PTSD is not limited to younger age groups and can persist or even emerge in older adults. However, due to the underdiagnosis and lack of awareness, the prevalence rates of PTSD among aging adults may be underestimated. Research has indicated that older adults with PTSD may experience increased risk of physical health problems, including cardiovascular conditions, diabetes, and chronic pain, cognitive impairments and higher rates of dementia, and reduced quality of life and functional limitations. When addressing PTSD in older adults, it is essential to consider various factors that can impact care. For example, stigma and cultural factors. Older adults may face barriers in seeking help due to stigma associated with mental health issues. Cultural beliefs and attitudes towards mental health can also influence their willingness to seek treatment. Additional factors include comorbidities and polypharmacy. Older adults often have multiple chronic conditions and take multiple medications, which can complicate the treatment of PTSD. Care must be taken to avoid drug interactions and carefully manage treatment plans. And finally, social support and isolation are also important factors to consider. Social support networks play a vital role in the recovery process. However, aging adults may face increased isolation and reduced social connections, making it crucial to address these factors when developing a care plan. PTSD care for older adults should be comprehensive and multidisciplinary, considering the individual's unique needs. Some key care options include psychotherapy, medication, and group support. Psychotherapy is evidence-based, such as cognitive behavioral therapy or CBT, and eye movement desensitization and reprocessing, EMDR, both of which have shown effectiveness in treating PTSD in older adults. Medications such as SSRIs may be prescribed to alleviate symptoms of PTSD. However, careful consideration should be given to potential interactions with other medications. And support groups specifically tailored for older adults with PTSD can provide a safe and understanding environment for sharing experiences and coping strategies. More specifically, consulting with an occupational therapist can be highly beneficial for older adults with PTSD. Here are 5 reasons why they may consider seeking the expertise of an occupational therapist. 1. Addressing daily living challenges. PTSD symptoms can interfere with an individual's ability to perform activities of daily living, or ADLs, such as bathing, dressing, meal preparation, and housekeeping. An occupational therapist can assess functional limitations, develop strategies, and provide adaptive equipment to help older adults regain independence and confidence in managing these tasks. 2. Managing anxiety and stress. Occupational therapists are skilled in teaching relaxation techniques, stress management strategies, and coping mechanisms tailored to the unique needs of older adults with PTSD. They can help individuals develop routines, establish self-care practices, and implement anxiety-reducing activities to improve overall well-being. 3. Enhancing sleep patterns. Sleep disturbances are common in individuals with PTSD. Occupational therapists can offer guidance on sleep hygiene practices, develop personalized bedtime routines, recommend environmental modifications, and teach relaxation techniques to promote restful sleep patterns. 4. Addressing cognitive impairments. PTSD may be associated with cognitive impairments such as difficulties with memory, attention, and executive functions. Occupational therapists can employ cognitive rehab techniques to help older adults improve their cognitive abilities, develop compensatory strategies, and optimize their cognitive functioning. And 5, engaging in meaningful activities and hobbies. PTSD can often lead to a loss of interest in previously enjoyed activities and social withdrawal. Occupational therapists can work with older adults to identify meaningful activities, establish goals, and develop strategies to reintegrate them into their daily lives. This can enhance social connections, promote a sense of purpose, and improve overall quality of life. Furthermore, families of older adults with PTSD may also benefit from consulting with an occupational therapist. Here are 3 reasons why they may consider seeking the expertise of an occupational therapist. 1. Education and support. An occupational therapist can provide families with valuable education about PTSD, its symptoms, and how it affects their loved one. They can help families better understand the challenges their older adult family member is facing, including changes in behavior, mood, and functioning. This knowledge empowers families to provide appropriate support and reduces feelings of confusion or helplessness. 2. Caregiver training. Caring for an older adult with PTSD can be demanding and overwhelming. Occupational therapists can offer caregiver training and support to family members, teaching them practical strategies to manage specific symptoms and behaviors associated with PTSD. They can provide guidance on effective communication techniques, stress management, and self-care practices, helping caregivers maintain their own well-being while supporting their loved one. And 3, home environment modifications. Older adults with PTSD may experience heightened sensitivity to environmental triggers or safety concerns. Occupational therapists can conduct home assessments and recommend modifications to create a calming and safe environment. This may involve addressing lighting, noise levels, organizing spaces to reduce clutter, and implementing strategies to minimize potential triggers. By optimizing the home environment, families can create a supportive setting that promotes their loved one's well-being and minimizes distress. Additionally, involving an occupational therapist can foster collaboration and open communication within the family unit. It provides a platform for family members to voice their concerns, ask questions, and work together to develop strategies that support the older adult with PTSD. This collaborative approach can help families feel more confident in their ability to provide effective care and support, ultimately improving the overall well-being of both the older adult and the family as a whole. Overall, consulting with an occupational therapist can provide older adults with PTSD and their families the support, guidance, and tools they need to effectively manage symptoms, regain independence, and improve overall well-being. In addition to professional care, there are strategies that older adults with PTSD can implement to manage their symptoms and improve their own well-being. Examples include engaging in regular physical activity, building social connections, and mindfulness or relaxation techniques. Exercise has been shown to have positive effects on mental health, reducing symptoms of anxiety and depression. Older adults should aim for activities that suit their abilities and preferences, such as walking, swimming, or yoga. Encouraging older adults to maintain and strengthen their social connections can provide emotional support and reduce feelings of isolation. This can be achieved through joining community groups, volunteering, or participating in hobbies and interests. And practices like meditation, deep breathing exercises, and progressive muscle relaxation can help older adults reduce stress and manage anxiety symptoms associated with PTSD. PTSD can significantly impact the lives of older adults, affecting their mental, physical, and emotional well-being. By raising awareness of the unique challenges faced by aging individuals with PTSD, we can foster a more compassionate and informed approach to their care. Through a comprehensive care plan, including therapy, medication, support groups, and self-management strategies, we can improve the lives of older adults and their families affected by PTSD and help them lead fulfilling and resilient lives. At Caregiver Consulting and Healthy Solutions, we are dedicated to helping you navigate aging together. Thanks for tuning in, and I'll see you next time.